So my name is Emily Plowman. I am an associate professor at the University of Florida in Gainesville, United States, but Perth is my hometown, so it's fun to be back. I just presented on a clinical screening tool to identify individuals who have ALS that also have swallowing impairment, otherwise known as dysphagia. In individuals with ALS, we know that approximately about 85% of them will develop a swallowing impairment at some point throughout their disease progression. We know that there's a lot of negative consequences that go with that, social isolation, reductions in mental health, and then a lot of very serious health conditions that can arise from that. So if the airway is not protected during swallowing, that can lead to what we call aspiration, that can later lead to aspiration pneumonia. And there was actually a nice talk yesterday that showed that aspiration pneumonia was the leading cause of death of individuals at a palliative care institute in Australia. So it really underscores the need that we need to identify these patients that have a swallowing impairment early so that we can intervene and hopefully extend survival and a lot of other positive outcomes. And so we've done work to show that basically in the United States there's no consistency in what clinicians are currently doing in their clinical assessments, and there's also a lack of validated scales that can accurately identify which patients do have a swallowing impairment and which do not. So this was really motivated, this work, by the need to identify patients early that have a swallowing impairment and accurately so that we can have kind of a triage precision medicine kind of intervention scheme. And so we validated in 250 patients a screening tool that actually has a very high accuracy. So for every 100 patients that would walk through the door, it will correctly classify 91 of every 100, so which is excellent. And so part of the scale, it's a very simple scale that any clinician anywhere could use. It includes doing a peak cough flow test, which is inexpensive and immediate. You get the result. It includes a validated patient report outcome called the Eating Assessment Tool 10. And finally, it includes the 3-ounce water swallow test, where a patient will swallow 90 mLs or cc's of liquid. And putting all that together in a model will correctly kind of predict if somebody may or may not have a swallowing impairment. So we're excited to present that here today. Yeah.